So you'd rather end up paying taxes for more mediocre healthcare with longer wait times? In Canada and England, patients literally die waiting. That's another falsehood. That's made up. Canada is the only country that has some form of socialized medicine that has wait times that are comparable to the United States of America, whereas every other country has better wait times than the United States of America. Nobody goes to the emergency room and goes, "Oh, I'm dying," and the doctors go, "Sorry." First of all, we do that here in America. We have to triage regularly in our emergency rooms, especially when you consider rural hospitals that do not even have adequate healthcare in most of the goddamn country because, hey, it's not profitable to have a hospital in the middle of nowhere. Okay, so that's number one. Number two, what you're describing is people waiting for not like life-saving medication. What you're describing is people that are waiting for like hip replacement surgeries and whatnot. The wait times can be a little bit longer for some of those surgeries. However, it's free. Do you understand? You're advocating to paywall something. You're either advocating to ration it off by who needs it the most, or you're advocating to ration it off by who can pay for it. And let me tell you something. You're not winning in the who can pay for it argument. That's so stupid. And the only reason why we have those wait times is because of a lack of investment. Exactly. You don't know what's happening in Canada, so shut up. No, I do actually know what's happening in Canada. I don't know why you think I don't know what's happening with Canadian healthcare. Every aspect of socialized medicine is oftentimes underfunded by capital owners who desperately want to cripple that socialized system so they can privatize it. Okay? The problem with Canadian healthcare is not because it's socialized. It's because not enough resources are going into it. Same with the NHS in the UK. Most of the time, though, those issues are also provincial. It's the provincial governments that end up doing that sort of thing. Every aspect of Canadian healthcare that is absolutely fucked is not because it's socialized. It's because people refuse to fund it. Politicians refuse to fund it. Same with the NHS in the UK. And the reason why they refuse to fund it or underfund it regularly is so they can substitute it with private healthcare. Okay? The premier of Ontario is literally privatizing our healthcare system. We will be America 2.0 in 10 years. It's hilarious hearing you talk about how great it is here. I never said it's great. I know it's not great. Literally just 2 hours ago, friend of the show, Jugmeet Singh, says, you, not CEO profit, should be the priority Canadian healthcare system. Conservative attempts to privatize it are putting that at risk, and Justin Trudeau is going along with it. What's happening in Canada is man-made orchestrated catastrophe. It's disgusting. Yeah. It's happening, again, in the UK as well. It's happening all over the place. You want to know why? Here's why. Because profit and the rate of profit has a tendency to decline no matter what happens through tech, through innovation. Profits are always going to decline. So when that happens, when profits decline, you have to find new avenues to extract profit. Okay? Whether it be whipping your workforce after it becomes more efficient and cutting it down, shaving it, and then the remaining people have to work extra hard with the same technological advancements, or whether it be trying to find new avenues of privatization that were previously controlled by the government. Okay? That's the reason why it's happening in the UK and in Canada, and it's going to continue happening everywhere else. The reason is that people have less power in those countries now. This wouldn't have happened decades ago in those countries. I mean, labor always has less power, but the real reason is because they are looking for new avenues to generate revenue, to generate profit, to boost profit margins. That's it.